Hello, my name is Mackenzie Milbrandt, and today I'm going to be presenting on smallpox. Smallpox is caused by the variola virus. It is a serious and deadly viral infection. Smallpox has affected humans for thousands of years, but was wiped out worldwide in 1980s thanks to the smallpox vaccine. There is no longer smallpox found naturally in this world. The last case was in 1977. There are still samples of the smallpox vaccine for research purposes in labs. A risk factor of smallpox is that it is very contagious, and any close contact has an approximately 60% rate of contraction if they are unvaccinated. Some symptoms of smallpox are fever, muscle aches, headaches, severe fatigue, severe back pain, or any other flu-like symptoms such as vomiting. There are 6 stages of smallpox. The incubation period is first, and it lasts an average of 10 to 14 days, followed by the initial symptoms, which last 2 to 4 days, and sometimes in this period, patients become contagious. The early rash phase is next, which lasts about 4 days, and this is when patients are most contagious. The pustular rash comes next, and this lasts about 10 days. However, scabs begin to form on day 5, and the patient is still contagious in this phase. The scabs fall off in phase 5, and this takes about 6 days for all of the scabs to fall off. And then in phase 6, there's no scabs, and the patient is no longer contagious. However, most patients are left with severe scarring, as well as have symptoms such as permanent blindness from the virus. Transmission is usually directly from person to person, but it can be indirect, such as from sheets that have touched pustules, or air transmission with improper ventilation systems. Usually directly from person to person, it's via droplets, such as coughing or sneezing or talking to a person. Pregnant women, elderly, unvaccinated, and immunocompromised people are the most susceptible to smallpox. Smallpox is usually diagnosed via clinical signs and symptoms. However, it can also be isolated from the blood or from lesions that are on the body. If the body has been exposed and created antibodies, that can also be isolated from the blood, and it usually happens in specialized laboratories that have dealt with smallpox before. Infection control procedures, such as isolating immediately, will happen when you first go to the doctor. They will also notify the infection control department, and they will use standard precautions when dealing with any smallpox patient, such as gloves, gowns, masks, eye protection, and face shield, which is essential to slow the spread. Rooms should be sterilized thoroughly afterwards. Any instruments that are disposable should be disposed of, and any that should be heat sterilized according to manufacturer's guidelines. Any surface that is non-porous should be wiped down with an EPA-registered hospital-grade disinfectant approved for the smallpox virus. And then all of the ventilation should be thorough, whether that's the heating or the air conditioning. The filtration needs to be good to stop the spread of smallpox. The number one prevention strategy is isolation. However, vaccination also is helpful. A vaccine can be given 10 days after exposure to the virus or prior. There are 2 different vaccine types. The first is the ACAM 2000 vaccine. This vaccine is not given to everyone because it is a live virus, and the risks of the vaccine outweigh the benefits. The risks are infections of the heart and brain and are very severe. There is a secondary vaccine called the Jynneos vaccine. It's a weakened strain, and it's less effective, but can be given to those that are immunocompromised and cannot handle the initial vaccine. It will still be beneficial. And my references. Thank you for watching. I appreciate it, and I hope you learned a little bit about smallpox.